So there are quite a few different streams for funding healthcare in the United States. And the first one is private insurance through your job, where every month out of your paycheck or every week out of your paycheck, a portion gets taken out that goes to the health insurance company, and your employer pays a portion of it as well. Um, and so it's really so access to health insurance through private insurance is really tied to working. If you get sick and you can't work, you lose access to health care in many cases. And there's some, vocabulary that goes with private insurance. People often have copays, which is, an amount you pay at every doctor's visit. So, mine is $20 if I see my doctor. My insurance pays for the visit, but I also have to give my doctor's office $20 in addition to the amount my insurance pays. And the reasoning behind that is if we have copays, people will go to the doctor less. It's sort of meant to curb sort of unnecessary, according to the insurance company, doctor's visits. People often can't afford necessary doctor's visits either due to the copay. And a lot of private insurance plans also have what's called deductibles. So you have to rack up a certain amount of out-of-pocket expenses before your insurance kicks in. So if your deductible is $5,000, you need to have $5,000 of spending in healthcare, and after you spend $5,000 in a policy year, your insurance company will pay the rest. So private insurance is one stream. Another stream is state insurance exchanges. So this is in Massachusetts, it's Commonwealth Connector. So they're income based. So depending on what your income is, you pay a portion and the state will pay a portion. And what percent you're paying depends on your income. And that kind of creates a pool of people who are all much like, if you work for a company and they're buying insurance for all employees at Blue Cross Blue Shield, they can negotiate a rate because they have, 5,000 employees who are all getting their care through Blue Cross Blue Shield. And so the state insurance exchanges act like a pool too, because 5,000 of us sign up through Commonwealth Connector. That makes a pool that the state can use to negotiate a better rate with Blue Cross Blue Shield or whoever. Another stream for funding health insurance or healthcare in the United States is Medicaid, which each states pay for, and it's for people with very low incomes. In some states, they follow certain conditions and get subsidies from the federal government. And certain kinds of disabilities you qualify for Medicaid too. It's really restrictive though because it's income based. So if you have a kind of disability that qualifies for Medicaid and you get married, so your income is now counted as your income plus your spouse's income, you lose Medicaid. So we do not have marriage equality because people can lose their Medicaid coverage and thus not be able to access health care if they get married, which is a big issue for people with disabilities. If you work enough that you're making enough money to survive, you no longer meet the income threshold for Medicaid and you get kicked off of it. Another stream for funding healthcare is Medicare, and that's the state government and the federal government both pay into that system. And it's for people who are over age 65. So once you turn 65, regardless of your income, you can get Medicare. And if you have a certain kinds of disabilities, kidney disease, for example, and there's like a long political story about why kidney disease is covered but liver disease isn't. It was because a congressman's wife had kidney disease, and he really wanted to make sure that what she had would be covered. And yeah, so a lot of like weird restrictions on it, but Medicare is what's called an entitlement program because if you are over 65, you're entitled to it, income regardless. However, a lot of healthcare providers don't accept Medicare because it pays less than private insurance. So a doctor can say, no, if I only get paid $70 a minute versus $100 a minute from people with private insurance, I'm just not going to accept patients who pay with Medicare. So that's really a problem for the elderly. It can be very hard for them to access care, particularly if they're not wealthy and able to pay, out of pocket or continue to pay for private insurance. So that's Medicare. Another stream of funding for healthcare is the Veterans Administration, or VA. This is an example of kind of a smaller version of universal healthcare. So, if you're a veteran, and you were honorably discharged, which is going to be an issue coming up with the transgender military ban. Many trans people in the armed services in the military are getting released without an honorable discharge, which means they may not be able to access VA benefits. They may not be able to access health care through the VA, which is a huge problem. I mean, it's a huge problem that people are being dishonorably discharged. I mean, it's a huge problem that trans people are being banned from the military. Although, I mean, maybe if we didn't have military, things would be better. But, I mean, so it's a problem on a lot of levels. But the fact that people who have served won't be able to get VA health coverage is really a problem, too. But, so if you're honorably discharged and you're a veteran, you can get care through the Veterans Administration. Oftentimes, you can only get care at VA facilities. So you can only go to a VA hospital or a VA clinic. You can't go anywhere else. And there's complaints that, the system's really underfunded. And so the quality of care is sometimes inadequate. And then Indian Health Services, which I don't have up here and I should, functions a lot like the VA. So kind of by treaty rights, members of certain sovereign nations and tribes, Native American tribes, can get health care through Indian Health Services. It's probably more underfunded than the VA. So, the federal government, by treaty that they made with Native American nations as part of, our land grab and cultural genocide, and sometimes actual genocide, as we stole people's land, some of the treaties we came to was that we'll provide health care or medical assistance through Indian Health Services. We're not exactly holding up our end of the bargain there because Indian Health Services are so underfunded, so inadequately funded, that we're not really, fulfilling our contractual treaty-based obligation. So those are the different ways of funding care in the United States. Here's some vocabulary that's helpful to know. So fee for service, I talked about at the beginning, is you pay a set amount for prices. So every time I need to get a cavity filled, it's $300, and that's just how it is. This works when the prices are affordable and sometimes when there's checks on the market. In a capitalist system like ours, there are no checks, so clinicians can charge whatever they want, and fee for service doesn't really work here. HMO, or Health Management Organization, is a type of insurance where you get, it's like a group of clinicians who fall under the umbrella of the HMO, who work for the HMO. You have a primary care doctor who kind of acts as the gatekeeper, who, along with the insurance company, decides if you can see other kinds of providers, if you can get tests. And that's, again, meant to contain costs or limit expenses for the insurance company so they don't have to pay too much, to make sure people aren't getting too much health care. And in practice, it's sort of like Carrie Ann Lucas, that activist I was talking about. The HMO says, no, we're not covering this. We're not required to, and people can die. People do die. The premium is the amount you pay to the insurance company each month. So it's like your bill. And if you have private insurance, your employer pays part of the premium. Copay, like we talked about, is that amount of money you pay in addition to the payment from your insurance company at an office visit or, if you go to the hospital. The deductible is the amount you have to pay for yourself before your insurance company starts paying as well. Prescription drug plans are included in some, but not all, insurances, and they cover, they cover prescription medication, and oftentimes there's rules around it. So they'll pay for generic drugs, not brand name medications. Generic drugs are usually cheaper and often older. So they're drugs that or medications that the patent has run out on. Patents last for 7 years in general, and then other people are allowed to start manufacturing them as well, not just the original inventor. And most of the time, a generic drug works just as well as a brand name one. Sometimes they don't. Sometimes, we have individual needs that we need a brand name drug, and prescription drug plans are not required to cover brand name drugs if we need them. And mental health parity is this concept that insurance or set of regulations that are sometimes enacted or advocated for that insurance companies would have to cover mental health care just as often or just as much as they cover physical health care. Um, so they can't say, yes, we'll pay for your foot surgery, but not for your mental health visits.